This is St. Louis on the Air from St. Louis Public Radio. I'm Elaine Cha. In November, 2 videos of Black women being refused care while in active labor went viral. One shows a Texas woman named Carrie Jones writhing in pain at Dallas Regional Medical Hospital as a nurse slowly fills out intake paperwork. In the other video, a mother named Mercedes Wells cries as she breathes through labor pains at Franciscan Health Crown Point Hospital in Indiana. Both women gave birth shortly after those videos stopped. These incidents caught on camera circulated across social media and garnered news coverage that brought renewed public attention to a persisting problem. Black women in the U.S. are 3 times more likely to die from a pregnancy-related cause than their white counterparts. This disparity exists in Missouri and Illinois. A recent report from the Pregnancy-Associated Mortality Review Program, which operates under the Missouri Department of Health and Senior Services, shows that from 2018 to 2022, Black mothers died at a ratio 2.5 times higher than white moms. And in November, the Illinois Department of Public Health released data from 2021 to 2022 that showed that Black Illinoisans had the highest rate of pregnancy-related deaths. Joining us today to discuss why this trend in Black maternal mortality persists and efforts around alternative birthing options outside the big hospital setting, we welcome 3 guests who can offer practical and clinical perspectives. First, we have Lora Gulley, Chief Operating Officer of the nonprofit Generate Health. Lora, welcome to the show.
Thank you for having me.
Also joining us is Elena Jenkins. Elena is a registered nurse and the RN program coordinator for the Missouri Collaboration for Clinical Community Integration in Maternal Health. Welcome to you as well.
Thank you so much for having me.
Now, the 2 videos that were described in our introduction, again, one of them took place in Dallas, Texas, another in Indiana, and these were videos that people were sharing and resharing throughout the month of November and December. What stood out to each of you about those videos, or maybe what is it that struck you about the response to them?
Yes, I would start by saying I wish I could say these were isolated incidents that never occur, or they occur every so often, but we're seeing these as becoming more of the norm. The things that stood out most to me were just the disregard, lack of respect, and the overall not listening to Black women who were expressing discomfort and pain that caused them harm.
Mm-hmm. Elena, how about for you?
I think what struck me most is the bias that was very obviously shown. It does not, you don't need to listen as much to see the pain that those women were going through. Mm-hmm. You know, as someone who has been a labor and delivery nurse in many different settings, from low risk to high risk, labor is labor. And as a labor nurse or an ER nurse, we have a responsibility to assess what's happening with the patient. That was blatant disregard and severe bias that was shown. And that is what hurts people.
Literally.
Yeah.
Now, according to Missouri's Pregnancy-Associated Mortality Review findings, on average, 70 women died while pregnant or within a year of the end of pregnancy every year between 2018 to 2022, and over 80% of those deaths were preventable. Now, we're talking about numbers generally right now. Now, what factors contribute to numbers like that? Elena?
I think one of the biggest things really is, like Laura said, making sure that women are listened to, that they are heard. So when there is a complaint of symptoms that are concerning, that woman is believed and that those symptoms are truly evaluated in a way that is standard, that across the board, these are the standards for our profession to be able to find out whether this is something that is life-threatening, could potentially be, whether we need to continue monitoring. There also needs to really be wraparound supports that hospitals can't always offer. It's about, really connecting with community. There are tremendous disparities, whether it be in rural areas or cities, in terms of access to care, the things that affect how we live, where we live, and more support needs to be provided because those things affect our health tremendously.
What you see at Generate Health, does that reflect what Elena has talked about? Do you have any maybe specific examples of how that's shown up?
Yeah, I think so. I would just kind of build on what Elena really particularly mentioned around there are small wins or things that are happening that we do know can make a difference. When we talk about quality care, respectful maternity quality care looks like someone being listened to about what are some of those things that are happening in an individual's life that could be the difference, whether it is a healthcare provider and or a someone on the care team. So it doesn't necessarily just have to be the physician that is capturing and listening, but when I look at the totality of what actually touches the lives of an individual that is birthing, we want to pay attention to.
Elena, you were nodding.
So true. I mean, I have a patient example recently of someone who had high blood pressure, was being monitored closely, but, just had a lot of symptoms. She had a community health worker following her and checking in with her every couple of days. There were so many different challenges that were going on, but she really heard what was going on with her. And she said, I just have this headache that just won't go away. I've taken Tylenol. It won't go away. And that community health worker was able to identify, hey, this is abnormal. This is really a risk. These are actually one of the symptoms we're looking for, where she wasn't thinking it was that serious. It saved her life that day. It truly, when she went into the hospital, she got her a ride to get into the hospital, called the hospital, all of these different things. It was that additional listening piece and connection to really follow what she needed, and it did save her life that day.
Yeah, we speak about all the time the village concept.
Yes.
And it doesn't just rest with the care provider. It is the community. And I really, want to elevate that as an opportunity for our region to step up to look for ways that we can, wrap families and support them in ways that we don't necessarily have to depend on a systematic or a system to do for us. We can do these things collectively together. And as your example was a really, really good example of saying that, when we listen to and take action, we can have good positive outcomes.
What we're talking about are statistics that have to do with the time when someone is pregnant. It is childbirth, and then there's also that postpartum period. And they sometimes, I think, could get sort of all smashed together. They're not looked at separately. Now, if we do take that kind of a view of it, what are some factors that figure prominently in postpartum challenges that people maybe are not thinking about when it comes to Black maternal health? Lora?
Yeah, I would say particularly making sure that the care after a delivery, that families know what to look for, if there are opportunities to ensure that the resources and supports or the stressors are relieved. When I think about the birth of a child, we, can think of the joy and opportunity, but there's also when you're faced with challenges with just making ends meet or stressing over other maybe stressors in your life with other children, that creates a continued or kind of a burden to add to the challenges that families may face. So providing wraparound other kinds of resources and supports could really make a big difference in that postpartum period as well.
And then when it comes to childbirth itself, Elena, in your experience, what is it that the hospital can do to prevent maternal death in cases where it's preventable? That keeping, the baseline would be to keep a mother alive, but what is it that can be done at the hospital level?
There's so many things.
What is the thing that comes most immediately to mind about that people seem to, like, they understand when you say it, but you have to keep saying?
Sure. I will definitely harp on listening, because the thing is that we know our bodies very well. We live in them every day. We are experts on our own bodies and when something feels different. And so I think making sure that we are hearing moms as they are telling us what is happening with their bodies, that puts together a whole picture, over the whole course of the pregnancy that can really, inform how we view things. And I also think just making sure that people are really involved in the decision making in their care, so that, again, as experts in our own bodies, we need to be able to be informed on the decisions that we make for the care that we receive, so we can really be involved the way we need to be.
Mm-hmm. Now, just days ago, on January 4th, Dr. Janelle Greensmith, a South Carolina midwife and doctor of nursing practice, lost her life while giving birth to her first child. And in 2017, Dr. Shalon Irving, an epidemiologist who worked on issues of health equity at the Centers for Disease Control and Prevention, died just 3 weeks after childbirth. These were Black women who practiced medicine. They were working to improve outcomes for Black mothers and, by extension, for their children and their families. Yet their knowledge tragically did not insulate them from the disparities that they'd been working to address. In your experience, Elena, how much do systemic issues, including medical training and bias, have to do with outcomes like that?
That's a really good question. I think that my heart breaks, first of all, for both of these cases. It is a gut punch like no other, because they dedicated their lives to saving other moms. In the case of Shalon Irving, she presented to care many times saying something was wrong, and the bias within, not hearing what she was saying is what led to her death. I don't know, in Janelle's case, what the case was. But there's so much that we can do to train, to talk about what we really need to be paying attention to, and what happens when we don't.
Mm-hmm. Lora?
I would also add, one of the things we talk about is bias in healthcare systems, but it also manifests itself on an individual and systemic way. Okay. And as we think about, we can't train our way out of it. We really do have to pay attention, elevating where there's opportunities for us to improve. When we see something, say something, and equipping not only providers with skills and resources and training, but with community members and folks that touch when there are multiple ways that we can approach this to get to resolution.
Mm-hmm. I think it comes down to our family and community that surrounds us, who may notice things that we don't notice when we're ill. That can be that kind of sounding alarm. It also is, like I said, hospital systems alone can't handle the problem. themselves, but, it needs to be a larger community effort.
Mm-hmm. We need to take a quick break here, but when we return, we'll continue this conversation about Black maternal mortality, why it's disproportionately high, and what can be done to change that. This is St. Louis on the Air on St. Louis Public Radio. Welcome back. Let's return to our conversation about Black maternal mortality and why rates of death in Black pregnant women and Black mothers continue to be disproportionately high. With us are Lora Gulley and Elena Jenkins. We have another guest joining us today, LaKisha Redditt. LaKisha is a doula and the founder of Virtuous Doula Training Academy. Welcome to the show.
Thank you for having me.
You've been waiting very patiently to join this conversation. Before the break, we were talking mostly about some of the numbers and the challenges that exist. But I want to move to speaking about some of the ways that you all are working to turn the trend of higher rates of Black maternal mortality, how to bring those numbers down. And one of those things is doulas and midwives. And this has existed for long before the modern hospital and healthcare system came to be. And Black women, in fact, were for a long time trusted with the responsibility of labor and raising children as doulas and midwives. LaKisha, how did you get into this work?
Oh, that's a long story.
The short version of it.
Try to truncate it. So I actually, I have 4 children. My oldest is 16. And when I was pregnant with him, I was in grad school and trying to figure out life and was reading some books and came across What to Expect When You're Expecting. Mm-hmm. And they have a little blurb in there about to doula or not to doula. And that was my first experience with doulas. I actually hired a doula because my older children were born in Little Rock, Arkansas. Mm. So I didn't have any family there. So having that support system was helpful, so helpful that I decided after that to actually start the process of becoming a doula myself. And that was back in 2009. So started the process way back in the day.
So it's been some time
It's
then.
been some time, yeah.
Doula work and midwifery have been on the rise. I'm hearing more and more about this. And when I was pregnant in 2015, I was also thinking about going that route. What is it that made these go away to begin with? Elena?
Sure. So there's some historical context. Back in the 1940s, midwives were pushed out. There's a couple of different acts that occurred that basically tried to replace all of the grand midwives with certified nurse midwives and with the physicians because physicians needed training. What that really did is remove the kind of natural process of labor and introduced the medical model of labor. And, and then very much made the midwifery field very constrained to school-based learning that was, accredited, et cetera, and really excluded diverse communities. And it became mostly white. I think still today we're greater than 80% of midwives are white.
Mm-hmm. Now, when we met in the green room, this was not the first time that you all met.
No.
How do you know one another? LaKisha?
Okay, so I think I met Lora first. I am actually technically part of the Missouri Momnibus steering committee, but we met in other ways, community-based doula support stuff. So when Generate Health was doing a lot of the support around reproductive health and Core Faith Walker was still alive, I was at some of those events and kind of met Rose Anderson Rice and Lora at the same time. And then Elena, I don't even remember how we met.
It's just part of the history.
Yeah, it's like we have been in so many circles together that over time it kind of gets lost on how you actually really met. But it's definitely been in community-based settings, and just kind of hearing about certain things and being at spaces and seeing familiar faces, and then creating those relationships.
And the beauty about this work is the networks. And as you were talking about how we're all related and connected, just this interlocking of wanting to see a better outcome, advocacy, and quality care and practice creates a network of individuals, of which I get an opportunity to sit with LaKisha and Elena.
Yeah. So with Generate Health, I mean, did it take some time to bring in or to incorporate the work of doulas and midwives, or was it already sort of there for some time?
So I would say as a community, there was an ebb and flow of support for doulas and midwifery work. And over time, as we look at data, there's some really, really positive outcomes associated with the support in the midwifery practice and doula practice. And as we look at what other things would help achieve the kind of outcomes, particularly for the community that was most burdened by some of the disparity outcomes. Black families experience those burdens, and doula and midwifery care had some promising outcomes associated with that. So that was really our impetus of looking at what would it take for us to significantly improve Black maternal health, infant health in our region, and that we pointed to that in that direction.
LaKisha, how accepting have hospital systems been to having and respecting doulas in patient rooms?
I think hospitals are becoming more receptive now. When we started this thing, there was only one hospital that was actually like really into doulas being a part of the healthcare team from the beginning.
Which one was that?
That was Mercy.
Okay.
And then once the pandemic hit, there was this push towards us being in more of these spaces, especially with families having to birth alone in some of these areas. So then what ended up happening, if I remember correctly, BJC started the process of having like tablets in the rooms for the doulas to be able to interact with their clients virtually. And then SSM jumped on board, and then SSM just grew a whole entire doula program, and currently SSM is the only hospital in St. Louis region that has a doula program established and running fully. So I just think there was a vision there, and then there was this trickle down effect that just kind of continued to happen, and then everybody's on board and pretty welcoming of doulas at this point. Some of the things that we see now is more provider based than it is hospital based. I feel like, you have the hospital system pretty open, but then you have a few providers here and there that are still kind of on the edge of whether or not they support doulas in the space.
Right. LaKisha's just mentioned SSM, and that is where you have been for some time, Elena. So how has that worked? How accepting have you seen SSM maybe become over time? Because things like this do not happen overnight. What do you think has made the difference in where you are, there being an embrace of doulas, if we can characterize it that way? Sure. And why have there been other hospitals coming on board?
Sure. So I think SSM took a really cool approach to the doula program in really integrating a doula organization called On Up to bring doulas in, as well as physicians and nurse leaders and, staff members all really worked together to create what does this culture change need to look like? What do we need to do? How do we bridge, communication gaps that currently exist? How do we bridge kind of some of the stereotypes that we normally have, and breaking those down, training through them, being able to kind of talk about what are the challenges with it. It's been a really eye-opening process over the last 2 years, and it's been amazing. And now it's phenomenal because it's, not only just St. Mary's who started this program, but it's also becoming integrated in all of the other hospitals. So I think it's, like LaKisha said, it's a gradual process of really understanding that we are all working towards the same goal of the health of the moms and babies and their family.
Mm-hmm.
Yeah.
One of the things that people are also looking for may be avoiding the hospital. What alternatives are there for places to give birth? Is this something that you've been part of, LaKisha?
Yeah, so we used to have one freestanding birth center, and it was called First Breath. It was out in O'Fallon, Missouri. And that was the only one in Missouri. And of course we have, the birthing center attached to Mercy Hospital. But when First Breath closed its doors, we lost the freestanding part of everything. And so now we only have the birth center at Mercy Hospital that's been established, but then you have other birth places that are kind of trying to model the same thing. The alternative to that is home birth. It's frowned upon, but you have some people that free birth, which is the process where the family gains all the information they need in order to have the baby at home by themselves without any medical professionals involved. And then, of course, you have your hospital setting in which if there's a doula involved, in our prenatal settings, we are probably talking to them about like how they envision their birth and what they want it to look like, and striving towards the goal of creating that in the hospital setting. At the same time, reminding them that these are things that we aspire to do and not necessarily going to be the exact outcome, but we're going to get as close as possible,
Elena?
Well, and that's this ecosystem where we no longer have that kind of midway point between the home births and the hospital births is exactly why that's a huge project that I'm actually working on right now to open the next freestanding birth center in St. Louis City. So I am working with a group of providers to do just that, to bring back that option for physiologic birth that is low intervention, that has been proven to have incredibly good outcomes for moms and babies.
Mm-hmm. In our last couple of minutes, I want to make sure we get to this question because there are more people than not who will give birth or choose to or need to give birth at a hospital. So in a sentence from each of you, how can we make things better in hospitals specifically to reduce this disproportionate loss of Black mothers? Lora?
Yeah, I would first say let's start with information, education, and just being aware of what what to expect. Also, to being, I think, tapping into what Elena talked about, is having a game plan for what you want to experience.
LaKisha?
Personally, I think more providers and residents need to see what physiologic birth looks like, so they're not surprised when they get into a space and you have a birthing person, experiencing maybe the low guttural sounds, or all the things that a birthing person can do. Seeing that firsthand, so it's not a panic, because sometimes I feel like it's a panic.
A panic, sure. And Elena?
Sure. I think especially my current role as a program coordinator has shown me clinical community integration is critical to be able to really provide the wraparound care that our families need so they're not falling through the gaps.
Elena Jenkins is a registered nurse, a labor and delivery nursing coordinator and longtime maternal health advocate. LaKisha Redditt is a doula and the founder of Virtually Birthed Doula Services, and Lora Gulley is Chief Operating Officer for the nonprofit Generate Health. Thank you, each of you, for joining us today.
Thank you for having me.
Thank you so much.
This episode was produced by Darius Varner.
Audio engineering and sound design by Aaron Dorr.
Our executive producer is Alex Hoyer.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations. And leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thanks.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.